Hello, and welcome to Conversations with the Calgary Chamber, and we're focusing on mental health issues today. I'm Deborah Yedlin. I'm President and CEO of the Calgary Chamber of Commerce, and I'm also Chancellor of the University of Calgary. Joining me today is Dr. Robbie Babins-Wagner, CEO of the Calgary Counseling Centre. Robbie has transformed the way Albertans receive, perceive, and deliver mental health services in this province, and has been leading the industry and the province in best practices in the areas of mental health services, stigma reduction, research, and training since 1986. Robbie is an entrepreneur and an innovator in the field of mental health and has worked to ensure Albertans have access to effective and affordable mental health programs and supports. Thank you so much for joining us today, Robbie.
My pleasure.
So initiatives like Bell Let's Talk Day, and Mental Health Week remind us that mental health isn't just a conversation topic for after hours. Mental health impacts every aspect of our lives, from how we show up as parents and partners to how we perform at work as employees and leaders, and how we are to our friends and our community. And with the boundaries of home and work blurred for many, combined with the heightened stress and uncertainty brought on by the pandemic, mental health challenges aren't just something that happened to someone else. Chances are you or someone you care about is impacted too. As the voice for Calgary's business community, we know mental health is just as important in the professional sphere as it is in our personal lives. Leading up to today's conversation, we invited our business community to submit questions in an Ask Us Anything format. So Robbie and I are going to have a conversation about what we should be looking for in terms of identifying mental health issues, how we can support our community, our family, our employees, our friends. And we're going to kick off the conversation with a survey from Stats Canada that indicates 1 in 4 Canadians screened positive for symptoms of depression, anxiety, or post-traumatic stress disorder. And among those, 94% said the pandemic has negatively affected their mental health. Let's talk about what you're seeing, Robbie, in terms of individuals and companies accessing your services and programs, and how has it changed compared to the pre-pandemic times? Have you seen a shift in the types of counseling requests or the kinds of conversations that you're having? And what do you think is driving all those changes in the higher demand?
Great, because that's a lot to do in the next couple of minutes. So we've been, the stats that you just shared are actually really interesting, because what it suggests is that the percentage of people that are impacting have gone up from 20% to 25%, because we've typically known research before the pandemic has told us it's 1 in 5.
Right.
So I don't know this for sure, but my guess is that number will probably go back to 1 in 5 or to 20% at some point after the pandemic, because I think the pandemic has created an opportunity for people to seek the help that some of them have needed for some time. Let me give some background to that. We've been working with Bell and other organizations, both locally, provincially, and across the country for a decade now, trying to decrease stigma about mental health. And we know it's working. We know more people are seeking help. But most people actually wait somewhat average of 5 years from the time that they first are worried or concerned about a problem till they actually do something about it. So they have to move from being worried or thinking about it to being bothered by it. So somebody's told them about it, an employer has raised it, a friend has raised it, a partner has raised the issue, and that's usually what drives somebody to seek help. What the pandemic did, I think, is create an opportunity, because everybody was talking about mental health, and the stresses on individuals and families were so tough, particularly in the early days in waves 1 and 2, and help was made so available to people that I think that it created an opportunity where people could just call and seek help, because a lot of people they knew were doing it. It was all over the media. And I think that was a good thing. I think at some point, so there was a lot of pent up demand is what I'm really trying to say and explain. Right. And I think at some point after the pandemic, probably 3 to 5 years after whatever normal looks like at some point in the future, I think we'll see that number creep down again to about 20%. What will happen to make that happen? I think just life going back to more of its routines, people being in contact with others, people being able to see their friends and relatives more easily, and just the social interaction and contact that people are craving with friends, family, workmates, etc., will, I think, ease a lot of people's distress.
So one thing I've noticed, and I'm sure you have as well, is that my question is really, because we have this heightened awareness of mental health and what we need. I mean, there's a lot of narrative right now about self-care and what it's okay to do, how to set boundaries. And so I'm wondering if part of where you see that sort of reversion back to what we used to see before, that 20%, is going to be the result of people incorporating what we've learned in the last 22 months about how we take care of ourselves. And we incorporate that on a daily basis going forward, so we don't reach a crisis. What is that something that makes sense to you?
I think so, it does, because the boundary between work and home will become clearer again.
Yeah.
Even if we have hybrid workplaces or different types of hybrid workplaces, and people will feel they have more control. One of the hardest things for us and our team at Calgary Counseling Center has been to help people set a boundary around when they're stopping work, when they're starting and when they're stopping, because they're at home, the computer's in a room nearby, they can just go in and do what they want. That wasn't an expectation that we had, but people felt an imperative because need was so great.
Yeah.
So I think this is one of the things that will change, because if people are in the office in any way, it creates that natural boundary between work and home.
And what about people just saying, you know, I'm hearing more in conversations casually that when you ask someone how they're doing, they're actually more open to saying, you know what, not having a good day. And so perhaps some of that comes into that sort of workplace mentality as well, where people just say, you know what, I'm here.
Yeah.
Not 100%, but I'm okay talking about that. Whereas, you know, 22 months ago, that might not have happened as much.
Absolutely. And I think that speaks to Bell's theme for its campaign this year is let's keep talking and let's stay connected, because the talking about it really allows people to say, you know, you may want to, you know, people will always offer ideas if they're asked, sometimes even when they're not asked. But I think it creates the opportunity for us to learn from others who may have been able to conquer this before we have, and also to get ideas and advice about resources that they might be looking for.
So for people, leaders, business owners, entrepreneurs, you know, maintaining positive mental health is complicated. Leaders often struggle to prioritize their own mental health while watching warning signs amongst employees, families, friends. And it's become, as you said, more isolated, more challenging during the pandemic. What do leaders need to show? How do they need to show up for employees, customers, patients, clients when they are? And what should they be thinking about in terms of maintaining their mental health? And what should they be prioritizing so that they're leading by example?
Well, I think leaders need to show in whatever way that's appropriate for them what they're doing to after their mental health, and to talk about that. And that's not historically what leaders have done. A turning point for my staff was last February, when February 21, when we were in a team meeting and somebody said, what we really don't know is how you're doing. And what's been tough about this for you? And something inside told me that I really have to be very transparent about it and what I was dealing with. And the hardest things for me was the fact that I wasn't seeing my kids and grandson who live in England, or being able to see my mother who's 90 living in Toronto. And I talked about that for me, we're all at different stages of life and all have different things on our plates. That was the biggest challenge for me, the lack of in-person connection with people I cared about. And I really said, ask me questions. If you want to know certain things, just ask me the questions, because there's not much I won't answer. And that, I think, shifted things, my own transparency, my own being willing to talk about my own vulnerability to some of this. And that was really important. So I also think that going forward, I don't think we can assume when we return to office that everything is back to the way it was, because it won't. I think there's still going to be fear. I think there's still going to be uncertainty. amongst our employees and even amongst some of us. And I think we need to give that time. I think it'll recalibrate as we'll have confidence that either the numbers are down, maybe we're less likely to have a new variant or wave, that we are in better position to manage some of those things. So I think those pieces will stabilize, and know that we're going to have more presenteeism. The fact that people are there is a good thing, but they may not be as productive as they were in 2019 before the pandemic, and that will take time. That adjustment will happen, but it will take time.
Did that surprise you, that question? How are you doing?
Both yes and no, because nobody had ever asked me in that quite way. But if somebody asked me, I would have told them.
Right.
So it's not, I don't usually start our team meetings by talking about how I'm doing. Right. We usually have a business agenda. We have a standard way of doing things in our meetings. There is a more of a personal part at every meeting, because we want to acknowledge cool things that have happened in the 2 weeks between our meetings, cool things that people have done. We do safety moments, we do other things. So we start all our meetings this way, but nobody had directly said to me, and how are you doing in that big group? So that was actually quite cool.
Yeah. And has that continued?
Yeah, but not so much in the big group, but I think I've offered more in the big group. They wouldn't have to ask me how I'm doing.
So one of the questions that's come in from our business community is, what's the first thing employers should do when an employee has a mental health challenge? Is it a referral to an EAP? Like, how should that be approached?
I think the first thing I would do is ask how they're doing, and ask them what they need, and ask them if they're already seeing. Have they talked to their family doctor? Have they seen a counselor? Are they on medication? And some of that may be personal. They don't have to, our employees don't have to answer that. But what we're trying to assess is, we don't want to refer somebody to a provider of any kind to know that they're already have had that conversation. So I don't usually probe too much.
No.
But I will probe a little bit, to the point, and I say to my people, you don't have to tell me any of this, but it would be really help me. Might help me help you. Yeah. And so I think just say the importance of knowing that you care, that you'll help them if needed, and that it's their life and they have the right to privacy as well. Yeah.
When it comes to mental health, so many people suffer in silence, and we know that there's probably a gender divide on that. And people don't know that they're experiencing the early symptoms of depression or anxiety. What are some of the things that we should watch for from a business standpoint and from a family standpoint, in terms of understanding or identifying how somebody's struggling, and perhaps even identifying warning signs within ourselves?
I think if you notice a change, like we all have down days, and I think culturally, we've lost the distinction between feeling down, feeling blue, and depression.
Correct.
Right. Yeah. So we're all going to have down days, just like we're all going to have great days, but they may not all come sequentially or at the same time. So usually I say to people, if you're finding that you just can't kick it, if it's been 3 weeks now and you're still feeling that way, if you're finding you don't want to go out, you don't want to see people, you don't want to talk to people, those are usually signs that there may be something brewing, that you may be struggling with a low-level depression. Your sleep may be disturbed, meaning you may used to sleep 7 hours a night, now you're only sleeping 4.5, and you're getting up in the night and you're obsessing or worrying about things. So I'd be looking to see what's changed in your own life. And if it's been 2 or 3 weeks, it'd be at that point that I would probably go either meet with my family doc or call a counselor or speak to somebody and get some initial feedback about what may be happening. Because the earlier people seek care, the easier the treatment is, the easier and shorter the treatment is for people. And the other thing I recommend to people, though it's really hard for people who are truly dealing with depression or the early signs or stages of depression, is to go outside, get some sunlight, and be active. Yeah. And I don't use the language of exercise because can be very off-putting for some people. Even going outside and going for a walk And it even could be on your street or your cul-de-sac or to the park nearby. It really doesn't matter. It's the act of doing something, and the sun has a positive effect on people. It's really important. Sunshine, and we're very fortunate in Alberta to have more sunshine, at least in Calgary, than any other city in Canada. That in and of itself is healing, and you'll always be, I'm never surprised when I do that, who I meet walking on a path or walking in a park, because I almost always meet somebody that I haven't seen in a while, and it's an opportunity to connect. So I think some very simple things, inviting a colleague to go for a walk at lunchtime. It doesn't cost money. Just change what you're doing and how you're doing it, and see if that makes a difference. I would do that before I did other things.
Again, there was another study that was released recently about the importance of, exercise or being active, and what that means and what that does for mental health. Certainly, it's something that continues to gain momentum in terms of the first line of defense for helping people who are depressed.
For sure. In the UK, as part of the NICE program within the National Health Service, about 10 years ago, they did a ton of research and came out with a new standard of care. And that standard of care for depression was that exercise and talk therapy were first-line treatments, to be followed secondly by medication if the exercise and talk therapy didn't work. And that was in place in the early part of it, and it kind of got whittled down over the years. And they've just come out in the last 6 weeks saying, we're going back to that recommendation now. The evidence is even stronger than it was 10 years ago. And we need to start recommending that people do that first before we provide medical intervention.
Do we need to be prescribing exercise, and literally prescribing it so that it is something that people will take perhaps more seriously rather than a suggestion?
Yeah, I think, but we don't have, I think it's a great, strong recommendation, but we don't have any control over whether people do that or not.
Right.
And so I think it needs to be a more important part of our conversations with people that we see. I know I talk about it both when I've seen clients and when I consult with clinicians about this, that it's really simple to do. It doesn't cost money, and it's going to make a huge difference to most people that we see.
It's just hard to be outside in Calgary when it's minus 40, even if it is sunny. That's one of the constraints, right? So we know that there's an economic impact to mental health in Canada, and it's estimated about $50 billion a year, $1,400 per Canadian if you want to do it on a per capita basis. What's the link between mental health and the health of a business? Can you draw the line for us a little bit more directly?
Yeah, I'm going to go broader first, and then I'll come back to that. In Calgary in particular, we've been living with economic uncertainty since November 2014.
Right.
We can see a direct line in our data, people's distress at the first session, based on an outcome questionnaire that we use, that the more economic uncertainty we have, the more mental health distress that we see.
Sure.
We were starting to see some drops in that before the fifth wave. I don't know that they're statistically significant yet. We'll be looking at that in this quarter. But now I think things have I don't think we're seeing that drop. And I think it's such a complex issue, and you could probably talk about the business aspects of this better than I can. But I think that we still have a lot of people in our community. I think the last thing I heard was that unemployment rate in Calgary was about 8%. It had dropped a bit, but it's stuck there at 8%. Yeah. And there are a whole lot of people that are still not employed, that became unemployed in late 2014 and 2015, right, because they either had trouble doing career transitions, they've had trouble reskilling, the opportunities haven't been there because of the economy. So we're seeing kind of some positive signs, but those signs are not there for everybody. Mm-hmm. And
do you think
with the pandemic and a lot of, for example, hospitality jobs have been more challenging for people because they've been in and out. And I think the hospitality industry has really carried a lot of the distress over the last 2 years. Yeah. Retail jobs a lot of those have disappeared, or the number of hours that are available to people are less. I think we have people that have been really in a lot of pain for a long time.
And I guess, yeah, the question I wanted to ask you was, is there sort of specific sectors that might be more impacted than others? Is it people who are in manufacturing situations, or is it people that are working on the front lines, whether it's healthcare, whether it's in the hospitality industry? Are there certain aspects of the business community that may be feeling this more than others?
Yeah, I think more office-based jobs is feeling it less because we've learned how to work from home. I think people that are more public-facing, whether it's retail, whether it's and industrial, are probably suffering more because they have to have people in their businesses, in their shops, in restaurants, in bars. And those industries are dealing with way more distress than those of us that have office-based services. And I think those employees are struggling the most. You know, one of the things the food bank tells us is that since the pandemic began, they've seen a 44% increase in people requesting food. And those are not people that are necessarily homeless. Those are people, many of whom we know. Last year, Vibrant Communities Calgary, and this is a really cool graph on their, and it's available on their website, did a food bank survey. And the food bank has this on their website too. So you can look at your neighborhood to see the number of both low-income people and the number of food bank users. I don't think there's a postal code in this city that's been untouched by this, including communities or wealthier communities. I looked at my own area and I saw those red dots on the chart. So I think that was a huge wake-up call to see that it affected every single postal code in the city.
And food insecurity contributes to other challenges within a family.
Absolutely. So that usually tells us that people are either paying too much for rent, so more than 25 to 30% of their earnings for rent, because it shouldn't be more than that, which means they don't have money for food and electricity and other
necessities
of life, or they've lost their job and maybe their neighbors don't know it or their friends don't know it, because it's hard, given many of us are home. Like if I look at my street, I don't know who's employed or not employed and who's lost a job. I just know that my neighbors are all around.
Yeah. So curious, you know, we talk about employee wellness, and it's easy, you know, when you look at how, accessing services. So I know that the Calgary Counseling Center has a very different fee schedule than other places. I also am aware of other organizations that may be able to adjust their, you know, what they charge people who seek help. And of course, some people do have employee insurance plans that will cover, but not everybody has access to the extra dollars that they need to get the help that that would help them in times of crisis. So question about, are there other avenues of seeking supports? There's a lot of apps out there. Do those make any sense for people as a first line of defense to try and help them sort of settle their mind, settle their anxiety, and sort of get them on a track? Or is this something that, you know, we do need that face-to-face contact with a therapist to help them help move going forward?
So there are a number of agencies in our city that provide service on a sliding fee scale, and we don't turn people away. Amongst those groups of agencies that do that, we'll see anybody in need. The issue then becomes, do we have wait lists, and how long are the wait lists? Because we've also seen huge increases in services. Our own service, last year we provided 46,760 counseling hours. That's almost a 22% increase compared to 2019, which is prior to the pandemic. Normally, we would see about a 3 to 5% increase per year. So we know this is about the pandemic. It's not due to chance that the numbers are up this high. So we're dealing with a lot, with we and others are saying, how can we accommodate people who are really in need and can't wait for service? And many of us have strategies to do that. Apps are helpful, but they tend to be more of an adjunct to counseling for people that are in need of counseling. Okay. So I think first line of treatment for me is always do the normal things you're doing. Talk to your friends, talk to your family, just connect with people, go outside, go for a walk. And not being simplistic about that, because these are really important strategies to use. If that doesn't work, then I would either seek education, more education, or counseling. Because if it's a problem that needs more intervention, counseling is going to work. If you're looking for education or information, apps are often a good choice.
Okay.
So that's the distinction that I would make. And the problem we have is there are a lot of apps out there, and people don't know which ones. And I don't even have any to recommend, because it would mean that I would have to look at them and assess them. And I haven't had the time during the pandemic to do that.
You've been too busy.
It's been busy. But there are good apps there. People are using them, but they're typically, the utilization is usually short-term, not long-term.
Right. And so just as a leader within whether you're leading an organization or a team of people within your organization, if you think an employee is struggling, one of your employees is struggling, but they don't recognize it or they don't want to get support, is there a way to open the conversation that is not threatening, that can help guide them towards accessing the services that they might need?
Yeah, well, we deal with this too with some of our employees, where we have to, even though we're in the business, there are times where we have to take action that we may not want to take. So normally we would start by having a conversation with people and say, we're concerned about you. We've noticed a change in either you're coming in late, your work's not the quality it usually was, like whatever the issue is. You seem to be really sad. I've seen that you're teary sitting at your desk. And if the employee really says, I'd rather not talk about it, say that's fine. I wouldn't challenge somebody and push them a little more. If you want to talk about it, I'd be happy to talk about it and see how we can provide you with the support that you're looking for. If you become, some employees will come back and some won't. If you become really worried about an employee's behavior and you think something needs to happen, what we typically do is do what's called a fit to work assessment. We'll ask the employee to fill out a form. We have this form that our HR team has pulled together. We ask them to go and get a medical assessment. We pay for the doctor's visit because the employee usually has to pay for that. And some companies have their own resources for this. We'll pay for that because it's really, because we have to write down why we're asking for this assessment. And then it gives the provider, the physician, whoever's going to do it, some feedback about what we're looking for. And they send out the completed form to us that tells us, yes, the person still can be at work, or maybe we have to reduce our hours for a period of time. Maybe they are asking for the person to have time off to go to counseling. It could be a variety of things. But instead of arguing with employee and it's either you're employed or not employed because you won't do this, we've actually added this other step, which I think is really empowering to the employee because they get that feedback from a third party, usually they know and trust.
Right. No, that's actually really good advice. So I have two questions left. The first one is, are you worried about a mental health pandemic?
I'm not. And the reason I'm not is because of what I said earlier. Because I think if some of the supports that are in place now continue post-pandemic, then we'll probably see the numbers go down from 25% to 20%. And the background I use for this is the flood. We were asked by the province to set up a satellite in High River after the flood. We were there for 3 years, and we found at the 2 3/4 year mark, the people stopped coming in with flood-related issues, and they were normal problems in living. But remember, the flood was terrible, but it affected a much smaller group of people than are affected by the pandemic. So I'm saying I think it'll take 3 to 5 years to recover from that. That's a guess, don't know for sure. I've looked at the research of other areas that have had disasters in the US and Europe. They say that too. So I think when people talk about the mental health pandemic, it's about the rise in requests for service and the rise in need. But I do think that there's some of that pent-up demand still built up, because I know people would have called us in waves 1 and 2 and said, I'm going to wait till this is over. And here we are 2 months. later, and it's not over.
Yeah. So my final question is, how can our listeners make mental health more about something to check off a to-do list, and really something that they shift to thinking about it differently, so that it is more than I would say, you know, a bright, shiny object as it is today, because we're all talking about it as much as we are.
I think it's about building it into the culture of the organization.
Yeah.
That it shouldn't be an add-on, it just should be what we all do, and it's a piece that we want to look after. So we have this year at Calgary Counseling Center, we've decided that the focus is on everybody's well-being. And we're teaching, our goal is to get people to slow down, to catch their breath, because we're not asking them to be this busy, but people are taking it upon themselves because the need is.
Right.
And we've stuck ourselves in the middle of this, saying, no, we have a responsibility, and we want to make sure you all have the skills to manage your work life, and that it doesn't bleed into your home life, and you can develop some of those boundaries. So in every meeting we've had since the new year started, that's been a theme. It's
to slow down.
Slow down. How do we think through things? How do we decide what's going to be on the back burner or what we have to do right now? Because there will be always more and more things come to all of our desks. So what's the priority given everything that's going on in our business, in our organization, and what can wait?
You're reminding me of something my father used to say to me: festina lente, make haste slowly. So thank you, Robbie. I really want to thank you for your insights today. And as we amplify the conversation on mental health, we talked about how businesses can promote positive mental health for themselves and their employees. We discussed some of the tools and strategies available to start and continue a conversation on mental health. Businesses have shouldered a good portion of the weight of this pandemic, and we can't lose sight of the fact that they are powered by people. And people need support, especially as we're coming through this fifth wave and hopefully out of this pandemic. But it's critical to our economic recovery, because it's critical to making sure that we can be productive. So I want to thank you, Robbie, for being with us today, to bring your expertise and your candor today. And I look forward to keeping this conversation going, because we at the Chamber recognize this is an important priority for our business community, and that we have to make sure that in order to be a healthy economy, we have to have healthy employees, healthy leaders. We all need to be able to be functioning in a way that is productive and good for all of us. So thanks again. Thanks to the audience for tuning in today, and we look forward to connecting with you again. Thank you.